Hi, everyone. Today, welcome to the Career Chat. I'm Krista Harmon. I'm one of the career readiness consultants here in Kent County, and I welcome Karen Foley. She is a medical social worker, and we're looking forward to hearing about her story. Welcome, Karen.
Thank you. I'm so glad to be here.
Well, the students are thrilled to have you too, because they love learning about careers. They know that they want to be somewhere in healthcare. And so before we actually talk about what a medical social worker is, why don't we just hear a little bit about your early career path? What were you thinking when you were 16 or 17? Is this not where you thought you'd end up?
No. And when I was 16 or 17, I really had no clue as to what I wanted to do with my life. But I did know one thing. I had an experience that kind of shaped that. We were a family of six, and I had four siblings. And my father had a really great job, and he lost it. My mother was a stay-at-home mother, and all of a sudden our family had absolutely no income, and it threw our family into just a tailspin. And I made a decision at the age of 16. I almost remember the day, and I said to myself, I will always be self-sufficient. I will never be dependent on anyone for my own well-being.
Yeah, that's a pretty impactful experience to go through, for
So
sure.
that's what I knew. That is what I knew. And I loved everything. I was one of those youths that just how could I decide? There was just so much. So I didn't know.
So when you were in high school, then you had all these interests, and obviously your family's going through a pretty traumatic time. What started leading you to healthcare then? How did you end up in that field?
Well, that's kind of a funny story because really no one in my family was involved in healthcare in any way, shape, or form. I went to Purdue University with the thought that I would major in communications. And that particular degree path took me to a little internship with the veterinary school, where I started being a producer, making videotapes of all these animal operations. They're really grisly for the veterinary students, but it was pretty darn fascinating work. When I graduated, I realized there weren't a whole lot of jobs for producers filming veterinary operations. So at that point, I decided, and you remember, my goal was to be self-sufficient. So I decided I would just flip into nursing. And I got into nursing school at Purdue University and did that and got my nursing degree. And then I was golden, because then I had a career path and I had income. It was at a time when I got married, I started having children, but I worked full time from the moment I graduated. And it was pretty exciting. So that's why I got into healthcare. And I loved it.
Yeah, I think what's important for the young people to hear is that internship was a really critical experience for you, that you got to be in something completely different that you had not experienced up to that point, right?
Yeah. And I always knew I liked science, but I didn't like math. So I wanted to, and I loved people and I loved animals, but I did not like math. So I really wanted a science related field that mixed all the things I love and that reward me.
Yeah, I'm wondering back, just to help the kids learn from some of your experiences, when you were back in high school, had you done any career type of testing or done any job shadows or anything to try to educate yourself before you went off to college? So that's something you would probably recommend to these young people, right? To continue doing this kind of stuff.
It's pretty cool you have that. I don't think we had that opportunity when I was in high school. I mean, we had counselors who were trying to help us get into college, but not a lot of direction on where we could go with it.
Yeah.
So I think that's much more advanced now. That's nice.
Yeah, as part of this experience, students that are in the immersion, they're actually doing some self-assessment too, and just to keep learning.
Yeah, but pay attention to what you love. You know, pay attention to what feels right.
Yeah.
You'll find one.
So one quick question that I'd like to have you describe what a medical social worker is. So you graduated with a communications degree, right?
Yeah.
And then how much extra did you have to do to get your nursing degree? Because obviously you had some of the general education parts done.
I did 2 years after. So I did a 4-year college degree, and then I did 2 years and got an associate's degree in nursing. Then you have to pass the boards to become a registered nurse. Nowadays, however, they want you to have a 4-year nursing degree. Almost all the hospitals, any healthcare entity is looking for the 4-year baccalaureate degree nursing. Yeah.
Okay, well, good. So you got through your education, then you were able to be self-sufficient, because as students, if you haven't researched yet, nurses make very good money for a 4-year degree. It's a very self-sufficient type of wage. So you became a nurse, and so I guess tell us now how this transitioned to medical social work, and help them understand what that's like versus a nurse.
Well, what that's like is life. So best laid plans, right? So I went off and I started doing nursing, and I loved nursing, and I was in a medical surgical unit in a hospital, which is kind of a general floor where you get all sorts of problems to work with. And then I literally decided at some point that I was missing the communications aspect, my first degree, and found out that they were hiring someone for a public relations job in the hospital. So after I did nursing for a couple of years, I applied for that position and got it. So then I ended up in public relations in a hospital setting. Very cool, very fun, kind of combining all of my degrees. I did that for a few years, and then a whole new career path opened up, and it was called marketing communications. It was a whole new specialty that just erupted out of the business community. So I moved into that path with my public relations degree and became a marketing communications specialist with the healthcare system. And then I became a marketing communications director with the healthcare system. So it just kind of kept evolving. I did that for a long time. I worked as an administrator in practice management. The hospital started buying practices, medical practices, physician practices, and including them in their big systems. And they needed people to help manage those and operate those. So I became very involved in that for a while. Then after a while, I decided I was really missing direct patient care. So I took a step back and I thought, wow, now what would I do next? What would I do next? And I decided that I was at a place where I would get my master's degree in social work. Because I knew that I would stay in the medical profession because there were plenty of social workers in the hospitals. But I thought that's all there was to it, the hospital social work. I had no idea that there were other roles evolving in medical social work. So I got my master's in social work, and then I was picked up by one of the Howenstein clinics to work as a social worker with Alzheimer's and dementia patients and other patients with neurological conditions like multiple sclerosis and strokes and all sorts of neurological diseases, Parkinson's disease patients. And I was the social worker that helped provide support to those patients and their caregivers, their family members. And I loved it. I finally felt like I was home. I really did. It was just magnificent. Then I became very involved in medical social work. I saw that it's not just relegated. Social worker isn't just about being a hospital social worker. It's also about being a medical social worker in physician practices, specialty practices. You can be an outpatient therapist in the physician practices. So many avenues. My head was exploding with ideas, so they put me in charge.
So that's how you landed in as being a clinical service manager in administration. But what I love about your path though is there are probably young people on this Zoom today that maybe have an interest in business because they've expressed that to me, but they also like medical care. And I'm so excited that young people can hear how those things can come together to work in public relations or communications or marketing for a healthcare system.
You know, my mother said a really important thing to me once, and she said, no education is ever wasted. Learning is never wasted. And that kind of gave me the permission to keep experimenting and building on my career. You know, it's when I look back now on what I've done, it all kind of folded together. But I didn't necessarily pre-plan that. it just kind of rolled. And
Yeah.
I kept just making it happen.
Yeah, and that's important for me to really communicate to young people. My career, the same, because there's so much pressure for young people to have it all figured out. And I know that's one thing they're taking away from these career chats is that it evolves, it's a journey. You have experiences that lead to another thing. And you had no idea that you would end up missing the direct clinical care so much, or that marketing communications would even be an expanding arena. You know, like I just want young people to hear that it's a journey and that you're always learning and evolving, and nursing from that starting point is just wide open for that reason. So let's focus. I know some kids won't understand or don't know yet what a medical social worker is. So help them understand what that's about.
Well, it's different things. And that's what's so cool about this new profession. Medical social work, we function in many different roles. So you have a big health system like Mercy Health, where we have 5 hospital campuses, 60 physician offices, we have 1,300 medical staff physicians, 800 hospital beds, and 7,200 colleagues. We work together we call it an interdisciplinary team. So when you're a medical social worker, you'll work in an interdisciplinary team with doctors, nurses, respiratory therapists, occupational therapists, medical assistants, front office people, referral coordinators. I mean, there's just so many people that you're working with to help the patient. A medical social worker works hard to help patients get rid of barriers that are getting in the way of their lives. So we deal with all sorts of issues we call them socioeconomic factors. Those are things like, do they have housing? Do they have an adequate source of food? Do they have an adequate source of income? Do they have childcare support? Do they have elder support? Are they safe where they're living? I mean, we just look and look and look for opportunities to improve their life. We help educate on their diseases. What behavioral lifestyle choices are they making that could be working against them? And then we try to help them remove those barriers and replace them with healthier ways to live. The roles we function in, there are still social workers who work in the hospital. They're largely responsible for making sure the patient has a smooth transition to another level of care, we call it, whether that's home with maybe some home help, or is it an assisted living type facility where they're independent but they need a little help, or is it full-blown nursing care where they need pretty much around the clock support? We're always trying to help them figure out that. We help with inpatient psychiatric hospitalizations, where we're doing suicide assessments, trying to make sure that the patient is safe to go home, or do they need to go to another place that will help keep them safe and work on some skills for a while to help them move past their horrible depression or anxiety. We work as outpatient therapists, as I mentioned, in some of the medical practices where we're working side by side with the doctors on how do we help this, I'll give you an example. How do we help this patient with diabetes who just got their diagnosis and now they're extremely depressed? How do we work together to help that person feel that they can work with their new diagnosis? We help them adapt to that. We often do very specialized work, as I mentioned, in some of the specialty centers, really having to understand all the different forms of dementia. There's so many different ones that cause dementia: Alzheimer's disease, Parkinson's disease, frontotemporal dementia. We have to know almost as much as the medical staff, in many ways, the nurses and the docs, about those diseases, about the medications, about the side effects. What do their caregivers need? We work a lot with the support systems of our patients. and helping to bridge gaps and improve their lives. So that's in effect what a medical social worker does. It's a very exciting field with lots of diversity. We can work.
Yes,
Yeah, it's
this
really
sounds
great.
like it. It
Yeah.
sounds very like again, just kind of an umbrella term where there's so much specialty under it. So one of our students is wondering, when you think about a typical day, is it a lot of interaction with patients? Do you have to do a lot of paperwork? Are you sitting behind a computer a lot? Kind of give us what some of those nuts and bolts of what the actual physical experience might be, besides working with the patients.
Well, with the pandemic, we're all sitting behind computers. We look forward to getting back to face to face with our patients. But yeah, in a typical day, it kind of depends on your role. Certainly, an outpatient therapist, a clinical therapist is going to be doing a lot more face to face work with patients. If you're working with a provider, whether it's in a specialty, a provider is a physician or usually a nurse practitioner, a physician assistant, we call them providers. If you're working with one of them, you tend to there's a lot more patient interaction and a lot more caregiver interaction. When you're doing the discharge work in a hospital, where you're trying to find that next level of care, you're doing a lot more desk work. But in all those situations, there is a fair amount of patient contact or family contact. I didn't even mention the ED. We have an incredible team in our emergency department of social workers. They work 24/7. They work around the clock. So that's a great way to get into medical social work, is taking that night shift once you've got your master's degree, because it gets you in the door. These are hot positions and people want them. So it's exciting.
Well, help the young people understand, they're high school students, so they're still exploring what they might want to do. What are some things they could be doing now in high school to kind of be gaining some skills or experiences to prepare them for something like this? Anything that you might recommend? Do you guys have any type of volunteering or internships or anything going on that they could get in, or what are your ideas around that?
Yeah, we don't right now because of the pandemic, that's for sure. I think things will open up again down the road for high school students, but I think it is a little challenging. It's a pretty closed system in healthcare to anyone who doesn't have a direct agreement of some kind with the hospital, just because of patient confidentiality and some of the exposure issues, I think. What I would recommend is that you certainly, if you're interested in medical social work, take science classes, take social science classes, especially biology. I love biology. Eventually, you'll like chemistry if you don't yet. If you go to college, they have some pretty cool chemistry courses. I would definitely be very involved in any kind of community activism. Diversity is huge, and to be a good medical social worker, you cannot be judgmental. You have to be willing to break down barriers and advocate for your patients. So anything like that would really, really set you apart too, just being super involved.
Yeah, I definitely been trying to encourage young people to, consider volunteer work, where you can be meeting people who are different than you to start to gain that experience. It's a great thing for your resume. You have to have hours, to get in certain programs. So just keep that in mind, young people. Yeah.
Yep. Yep.
As far as, I guess I'd like to have you just consider for a minute, what's been one of your best days as a medical social worker when you thought, man, I'm really making a difference here? And maybe if you can think about one of your harder days, just so the kids can have a realistic expectation of what it's really like.
Well, probably one of let's see if I can think just a minute about that. I think one of my best days was when I was working in the Howenstein Neuroscience Center, and the doctor had asked me to meet with the family after he had given the diagnosis the guy was probably 78-year-old man and his wife, that he had Alzheimer's disease and was going to develop, over time, Alzheimer's disease progresses. I'm sure many of you have someone who's had to go through that in your family. And the wife just started sobbing. She just started sobbing. I mean, it was so hard on her. And it's kind of interesting that when you watch someone get the diagnosis of Alzheimer's dementia, we usually don't see them until they're kind of in the moderate stage of dementia. And it doesn't hit them the same way that it does their loved one who's going to care for them. It's much harder on the loved one who's going to care for them in a way. So that would have been my most special time, because I was able to really sit with that family and talk with both the husband and wife in a way that helped them both, which is real tricky because you've got one really upset person and you've got another person who's a little upset, but they're mostly upset because their loved one is crying. They're not quite sure why.
Yeah.
So those are my favorite days, when you could really get through.
Yeah, it sounds like making a difference, like you say, that direct, tangible, being that listening ear, being that support, you know that you're making a difference.
It's so rewarding. And it's not even that it rewards me as much as it feels like a privilege.
Mm-hmm.
It feels more like a privilege to be that intimate with someone's life. Incredible.
It is really quite remarkable, isn't it? Healthcare in general, you're really dealing with such intimate things, whether it's, you're helping someone with a mammogram, or you're helping someone, who just had a baby. It's helping someone with a diagnosis like that. It's an intimate thing. And I think that's a really beautiful part of healthcare. And so as young people start to self-assess, where they want to be, some will decide, I don't want to be that close to the action. I'd rather be a support person behind the scenes at a hospital, maybe being a data analyst, or, being someone who's in the lab, which we've had some guests talk about that. So that's what this whole process is about too, is that young people can hear these stories and start to think, that sounds good to me, or not so much. And that's cool,
Yeah. I just want to say one of my other greatest joy of all was I started a support group for caregivers of patients with Alzheimer's. And it grew to be the largest support group in the United States.
Wow.
We had 40 to 50 caregivers who had come to this support group. And we never had a topic. If you can imagine, we just sat there in this big square, and people just formed these relationships that were so powerful in helping them weather the care issues that they were facing. It was fantastic. That was really the highlight.
Yeah, that's a beautiful highlight, Karen, for sure. We only have 5 minutes left. So I want to help the kids understand, not kids, you guys are young adults, behind the scenes. Obviously, to be a medical social worker, it's a master's degree, like you had a master's degree at that point. Are there any other roles that you help see in your departments that you're managing that are right out of high school kind of jobs, or just 2-year jobs in your particular area? I know that maybe you don't have the technicians like some of the other departments do.
Not in my area. No, mine are, I think they start at the baccalaureate level with RNs. We have RN case managers, and that's a specialized job that RNs can do, a lot of desk work. Mm-hmm. So it's not for everybody. It's a lot of bedside nurses who get tired.
Sure.
Sit down and do some computer work and phone work, but it's very complicated, so they have to be very, very knowledgeable. So,
well, and you're really not even effective in those kind of roles till you have some experience under your belt, right?
Yeah, you can almost expect when you move into the healthcare world that you're probably going to have to go for a master's degree, depending on what you're looking at, because most of the roles they want you to function at the top of your licensure. And it's just gotten competitive. These are good jobs, they're good paying jobs. They're fairly stable, but there are, and I heard some of you like business, there are a lot of business jobs in healthcare, a ton, where you have no patient interaction whatsoever. And they're very good business jobs, very good.
Yeah, that's helpful for young people to hear. So I think I'm just trying to think. I personally have had some interactions, and I think I want young people to know that these kind of jobs can happen also at like the children's hospital. They have medical social workers. You know, there's just so many environments that you can do this kind of work, right?
Absolutely.
Yeah.
Absolutely. Many, many, many.
Yeah. So depending on your interest, you guys, you can find a medical social worker in that area, like she was saying with, you know, mental health or the ER. So again, I just want you to help understand it's just a very broad topic. So Karen, as we finish up these last 2 minutes, I want to share with the young people a resource where they can just get a little more nitty gritty. So I have been sharing with you guys ONET online. And if this is your first time, I wanted to introduce you to another website. This is called mynextmove.org. And it's actually the same data, you guys, as ONET, but it's kind of set up more for a student appearance. So it's a little easier to manage. And so there's 3 ways you can get information. You could put social worker or medical social worker right into the first column where it says search careers with keywords. Or if you know, man, I know it's somewhere in healthcare and you just want to see what My Next Move has in that category, this has drop down menu. And then there's also an interest, it's called an interest inventory on here. And so that's where you just answer a bunch of questions. It'll give you some matches of jobs that might be a good fit for you. So when I put in clinical manager, because that's one of Karen's titles, these are the kind of things that came up. And so you may not even be familiar with what a clinical, the fourth one down, a clinical data manager, a biostatistician. And again, that's why I want you guys to know about these resources so you can just get in there and start checking things out because you don't even know what's out there, right? And so again, My Next Move is an awesome tool. You can click on those and then you'll get all the information about kind of the nuts and bolts of the job. And Karen, I so appreciate you being here. Karen has been generous to offer her email, you guys, if you have a follow-up question for this particular field. So Bug, is that your maiden name? Bug K?
How'd you guess?
At mercyhealth.com. So, and we have lots of thank yous coming in, Karen. So as we finish up, and again, my name is Krista Harmon at Kent ISD, if you have questions for me. Final word of wisdom. What do you think, Karen, as these young people make some decisions for themselves? Anything you'd like to finish up with?
Final words of wisdom would be just to keep on learning. Learn your whole life. Learning is one of the most important things you can do. And the second thing for social workers, be kind. Please be kind. Those are my words of wisdom.
Awesome. Well, that's very helpful. And if any of you have had, you know, if you want to be self-sufficient economically, these are the kind of right jobs to be looking at, just like Karen proved with her just career that she's been able to support herself. So that's a beautiful thing, Karen. Thank you so much.